Good morning, everyone. Thank you for joining me today. I'm Riya Kayarkar, and today I am going to talk about socioeconomic factors affecting hypertension and obesity, a systematic review. I would like to thank the team of Cardio Immersion Conference to give me this opportunity to be able to speak on the topic. And today we are going to explore the significant impact of socioeconomic factors on hypertension and obesity, and also revealed by a comprehensive systematic review. As we all know that hypertension and obesity are pressing public health issues and causing substantial morbidity and mortality worldwide. So let's move on and get to the objectives and methods of this particular um, topic. The importance of understanding the role of socioeconomic factors in hypertension and obesity. Research has consistently shown that socioeconomic factors such as income, education, access to healthcare play a crucial role in development and management of these conditions. The objectives of this presentation is association between the socioeconomic factors and hypertension and obesity, then the effective interventions aimed at alleviating the burden of these conditions, and the potential impact of COVID-19 pandemic on the socioeconomic disparities related to the hypertension and obesity. Coming to the methods section, we gathered relevant studies. A systematic search was conducted on electronic databases, including PubMed, Medline, and Cochrane Library. This comprehensive search involved using keyword mesh terms related to the socioeconomic factors, hypertension, and obesity. A meticulous selected process was employed to identify eligible studies. Inclusion criteria were predefined to ensure the relevance and quality of the studies. These criteria considered factors such as study design, population characteristics, and outcome measures. By adhering to strict inclusion criteria, we ensured that the inclusions of studies that provided valuable insights into association between socioeconomic factors, hypertension, and obesity. Data extraction was critical step in this particular systematic review, and a standardized form was used. It also included details such as study design, sample size, socioeconomic indicators, outcome measures. By extracting and organizing the data systematically, we were able to analyze and compare the findings across selected studies. And to assess the quality, we included the Cochrane risk of bias tool, and this tool evaluated in various aspects of study design, such as like randomization, blinding, attrition, to determine the risk of bias in each study. Assessing the quality of the studies helped ensure that we are able to be, reliable. Coming to the results section, our systematic review analysis had 35 studies, in which 18 focused on hypertension, 14 on obesity, and 3 on both the conditions. The findings demonstrated that the lower socioeconomic status was associated with a higher prevalence and incidence of hypertension and obesity. There were various factors that influenced this particular finding, and especially like poor diet quality. So in lower socioeconomic status is often associated with limited access to healthy food options, resulting in a poorer diet quality. also having like an unhealthy dietary pattern, which kind of includes high consumption of processed foods or sugary beverages, contributed to the development of hypertension as well as obesity. The next one was like limited access to healthcare, because individual with lower socioeconomic status may face barriers in accessing healthcare services, which includes having preventive care and management of chronic conditions, as well as lack of regular healthcare visits and monitoring of which can often lead to undiagnosed or poorly controlled hypertension and obesity, and further also diabetes. Um, the next one was higher levels of chronic stress. So we saw that the socioeconomic disparities can create a chronic stress among individuals, which can contribute to development and progression of hypertension and obesity. Stress related behaviors like emotional eating, sedentary lifestyle can further exacerbate these conditions. So it's very important to note that while lower socioeconomic status is generally associated with a higher burden of hypertension as well as obesity, there are certain nuances to this relationship. Uh, just for an instance, a cross section study, we did the cross sectional multi level analysis that was conducted in India, revealed that the high socioeconomic status group accounted for a significant burden of diabetes, hypertension, and obesity in this population, about 70 to 90%. And this highlights that the complex interplay between socioeconomic factors and these health conditions, which can vary across different regions and demographics and have a different perspective. Um, and these findings emphasize the need for target interventions and policies to address the socioeconomic disparities in hypertension as well as obesity. So, in this slide, I just wanted to highlight the study that we were talking about in the previous slide. The cross sectional multi level analysis conducted in India, which showed the higher socioeconomic status groups accounted for a significant association of diabetes, hypertension, and obesity in the population. And this was across different states in India and also different regions. And there were other studies too that we will follow up in the next slide. So coming to this slide, I wanted to emphasize on a study that was conducted in Bangladeshi adults. It was about higher education level and in a higher household wealth quantile. They had a significant increased prevalence of diabetes, hypertension, overweight, and obesity. As you can see in the graph in this particular slide, the top shows the prevalence by education level, and the bottom shows the prevalence by the wealth quantiles. And in this particular study, they found out that the higher household wealth quantiles and a higher education level did have a significant higher prevalence in these conditions. And there were other studies, like several other studies that were done in Bangladesh that showed similar findings. Also, that we discussed in the previous slide, also showed about the multi-level cross-sectional study done in India, that the higher socioeconomic group did have a higher prevalence. So coming to the strategies to reduce burden, we have findings emphasizing that the need for targeted intervention and policies to address the socioeconomic disparities in hypertension and obesity. So there have been promising interventions. One of them is financial incentives for healthy food purchases. So there was a recent randomized control trial that kind of demonstrated that providing financial incentives to low income individuals for healthy food purchases significantly kind of improves the diet quality, leading to reduction in both obesity as well as the blood pressure. um, there was another incentive about expanding access to healthcare. So here we could say the policies that aim to improve access to healthcare services, particularly for disadvantageous population. They can contribute to better management and control of hypertension and obesity. Um, Also having promoting healthy food options and safe physical activity, so basically implementing policies that promote availability as well as affordability of healthy food options, as well as creating supportive environment for safe physical activity. This can significantly reduce the healthcare discrepancies. Um, and also, we have seen that COVID 19 has a significant impact on socioeconomic factors, further exacerbating the disparities, and changes in employment, income. All of these have intensified the challenges faced by these populations, and therefore it is very crucial to kind of address the socioeconomic impact of pandemic to mitigate its effect on health disparities. So, in conclusion, this systematic review confirms that there has been a significant role of these factors in the development and management of hypertension as well as obesity worldwide. This graph demonstrates the association with socioeconomic status and association with the hypertension and obesity. And it does define that higher socioeconomic status is associated with a lower risk of hypertension and obesity, even if it did have studies showing that it has a higher prevalence, although the lower socioeconomic status has a higher risk than the high SES. To summarize the conclusion, our systematic review has shown the significant role of socioeconomic factors in the development and management of hypertension and obesity globally. Effective interventions targeting socioeconomic factors have demonstrated promising results in reducing the prevalence and impact of these conditions for individuals as well as the communities. Policymakers should focus on promoting access to healthcare, implementing policies supporting healthy food options, safe physical activity, and considering socioeconomic impact of COVID-19 pandemic. Um, Healthcare professionals can utilize this knowledge to kind of identify high risk patients and tailor interventions and kind of help reducing the burden of hypertension and obesity. By raising awareness of the role of socioeconomic factors, we can guide future research and also development of evidence-based interventions to improve patient care and to reduce disparities. So, in this particular slide, I would like to focus more on the role of a healthcare professional and for them to identify any disparities in healthcare access, addressing, providing equitable care for all patients, and educating the patient. Very important. The importance of the lifestyle changes to reduce the conditions like the hypertension and obesity. So yes, so the healthcare professionals, as all of us know, play an important role in reducing the disparities in healthcare access and outcome. So, by identifying, addressing, and educating the patient on the importance of lifestyle changes, can possibly reduce the disparities. So, with this presentation, I hope I addressed the significant findings and also addressed the significant role of socioeconomic factors affecting obesity and hypertension. And this is a little quote from me. The journey of 1,000 miles begins with a single step. So the single step could be anything, even if in terms of this particular systematic review where I explained that healthcare professionals could educate the patient. That could be the single step. So thank you so much for staying with me. Thank you so much to be patient with me. I will be very glad to have any opening questions to answer or hearing your insights on this topic. Thank you so much for staying and giving your attention and having an active participation in this presentation. Thank you so much.